Hello. So this is a case of choanal atresia with left side partial blockage and right side complete blockage. So you can see we had shown the left side first. There is a very small opening. It's a membranous atresia with a small opening in the left side. And now we are clearing the right side mucus secretions. As you can see, a lot of mucus is there, and once we go towards the posterior end of the nasal cavity, that is the choana, we can see a complete wall of atresia seen on the right side. There is no opening left in the right side. So now we proceed on to infiltration of the septum, as we will be doing a posterior septectomy, and the process we are following for this endoscopic choanoplasty was first described by Aldo Stam. So in this technique we remove the posterior part of the septum so that there is no chance of synechia formation between the medial and the lateral wall, and we also create two flaps, one in the superior aspect and one is the inferior aspect. From the left side and from the right side, both the sides, we make two flaps, one is inferiorly based and one is superiorly based, and we cross over the flap to the opposite side to cover the raw area. So here we are trying to create some space by lateralizing the inferior turbinate, and now we are putting incision in the mucoperiosteum of the posterior end of the septum using a modified circular knife, insulated circular knife with electrocautery. So we are taking the incision first on the left side, and as you can see we are taking inferior to superior direction. This flap will be based on the supply from the inferior aspect, and the opposite side of the septum a flap will be raised which will be superiorly based. So we proceed on to raise the flap on this side. So our aim is to take out the flap, raise the flap without touching the atresia initially. We preserve the mucosa and periosteum well, and then after raising the flaps we go deep and we'll take out whatever bony or the membranous segments of atresia are there. And so now in this section you can see we have raised the flap on the both sides, and now we are seeing the posterior end of the septum being removed, that is the posterior septectomy is being done. We have taken small bits of videos from the surgery, and here we have removed the posterior end of the septum, and you can see the atretic plate being cauterized after the cautery has been done, and we are using a micro debrider to take out the atretic segment, that is the posterior end of the choanal atresia. So as you can see we have opened up the atretic membranous segment, and we can see the nasopharynx, the portion of the nasopharynx with the pack inside. So now we have opened up the atretic segment. We are also trying to remove the remnant of the atretic area using a bipolar cautery. So we have removed both the atretic segment from both the sides, and we are also taking out the septum from its posterior end. So here we are using a scissors to cut the superior part of the posterior end of the septum. And mind it that we have preserved the mucoperiochondrial mucoperiosteal flap on the both sides, so that we can use it for covering the open raw area superiorly and inferiorly. So here the septum is being cut. Again, in the left side we are doing the same thing. We are converting both the posterior choana into a single large opening without the intervening septum in between. So we have converted the posterior choana from the both sides into a single large cavity. We can directly see the throat pack from the nasal cavity. This is the throat pack which is seen within the oropharynx, and see the widened nasopharynx is clearly seen, and there is no intervening septum in between, so both the sides of the nasopharynx are clearly seen. Now most of the work is done. I could not show the part where we are removing the bones, so we removed the bony part of the choanal atresia using chisel, and also we did use some kerrison bone punch to remove the bony overgrowths. We also removed the rostrum of the sphenoid using a chisel, and as you can see that our work is done. The flap has been deposited, and we are putting a Foley's catheter and inflating the Foley's bulb to keep the flaps in position, and we'll keep this Foley's catheter for 7 days. Remnant of the septal cartilage which was impinging onto the flap has been removed. This is the post of 7 days endoscopic image after taking out the Foley's catheter. 7 days post of image, we can see that it is well healed, and the cavity there is not much granulations, and it is very widely patent, and hopefully there will be no synechia. Thank you for patient listening. Have a nice day.